Hi, welcome to the second session of 5 Minutes with the Expert. And today we have with us Dr. Basil Nasrallah. He is the consultant pediatrician and he has special interest in allergy. He works at Emirates Specialty Hospital at Dubai Healthcare City. Dr. Basil and I worked together at American Hospital for 4 years, and now it's very nice to have you back, Dr. Basil, on this.
Thank you. Thank you, Sridhar, for the nice invitation into your YouTube channel. It's a pleasure to be with you tonight.
Thank you. As I said, this is a discussion that we are aiming to give parents information about use of the inhaler and the nebulizer. And we know that we both worked in UK and you worked in US as well. So in both these places, nebulizers are used mainly in the hospital. But in Dubai and UAE as a whole, nebulizers are quite widely used at home as well. And we both know that it's a little more difficult to use a nebulizer compared to the spacer. And I would like you to shed light on which cases you would choose a nebulizer in preference to an inhaler, and what are the pros and cons?
Sure. Thank you again for the invitation. It's a very important point to talk today about the differences between nebulizers and inhalers. In asthma and viral-induced wheeze, medicines need to be delivered to the lungs. And there are two ways to give these medicines, either through a nebulizer machine or through an inhaler. What is the difference is, nebulizer machine, it's a big device. It's usually electric powered or battery powered, a bit bulky, a bit noisy. You have to have the medicine fluid form. You put it in the machine, and which goes through tubes and a mask inside the airway or the lungs to do the work. It's a bit expensive too, and you can't hold it with you everywhere you go. For example, if you are on the airplane or in a restaurant or to the school, it's not easy to hold the machine with you because of the electricity and the size of the machine. On the other hand, the inhalers, they are small in size, portable, cheap in price, easy to use, and you children can take them in their pocket to the gym or to the sport class, school, restaurants, and use them without needing for a power source. And both of them, as I said, can be used and they can deliver the medicine, and both of them, they do the work, they do the job. And if you want to scientifically compare which one is better in terms of effectiveness, when we say effectiveness, that when you give the medicine through the nebulizer and give the medicine through the inhaler, which one is more effective in terms of symptoms improvement, less visits to the emergency room, less hospitalization. And there are a lot of studies in the literature done comparing both of them. And these studies showed, most of them, they showed that the inhalers are a little bit more efficient or more effective than the nebulizers. As you said, in the West, where we practiced before moving to UAE, we don't see nebulizers used at home. Most of the parents and the children, they are trained to use the inhalers, and they are more cost effective. And if you teach the child how to use them, they will do them perfectly without any problem. In UAE, when we moved here, there is a cultural trend. I think this is how they were being treated before. Or the parents, when I ask them why you prefer nebulizers, they feel or they think it is more efficient because when you go to hospitals and to ER, they use nebulizers machine on the kids. So that gives them the impression that the machine is more efficient and more effective in treating the symptoms.
But with a little practice, in the ER, they are running it on oxygen, and that's the main advantage in a sick child, isn't it?
Exactly. In the ER, they run it on oxygen, and also the machine in the ER, the compressor is different. The mist particles, which generated by the machines in the hospitals, is different from the mist particles generated by the commercially available nebulizers. As you know, nebulizers, there are different ranges. Some of them are very expensive, and some of them are very cheap. So that means there's a difference even in the nebulizers. Some nebulizers, really the particles size is not small enough to go inside the lungs and do the job. So you have also to be careful when you prescribe the nebulizer to make sure you know what you're prescribing, which nebulizer and which particles to work to do the job. So not any nebulizer will do the job. Some of them, even they are portable, battery operated. And these ones, they just do a little bit of mess. The particles is large. Most of the particles deposit in the mouth and the upper airway. They don't reach the lower airway. So yeah, we have to be careful what we are prescribing and to know exactly which model we are using. For me, in general, I prefer the inhaler, and I try to train and teach my patients how to use the inhaler. There are different types of inhaler. The meter dose inhaler, which need to be used with a spacer. You cannot use them without a spacer. The spacer will help to contain the medicine, and then the child can slowly breathe the medicine through a spacer, either through a mask if he is a young child, infant, or through a mouthpiece if he's a bit older. So if you want my honest opinion, looking at the whole things, the advantages from cost effectiveness, portability, I find better to go with the inhalers. And I try to convince my patients to go for the inhalers. If the parents don't feel comfortable, even after training them, after explaining to them, I agree sometimes to go with what they are comfortable with, which is the nebulizer machine, but I have to be careful which one to prescribe and which one to use. Both of them at the end, they do the job. Both of them, you have to, as a parent, you have to know how to use, how to prescribe, how to put the medicine, the doses, because in nebulizer, you have to measure the medicine. And the medicine comes in a fluid, and you have to know what is the dose, half ampoule, full ampoule. Sometimes they give by mils. So all of these is even more difficult on the parents. While with the inhaler, the meter dose, the dose is already ready just to press on the inhaler, and the dose will go to the spacer or to the
You
lungs.
have a quick mention on cleaning the nebulizer.
Sure. Nebulizers, more difficult to clean. They are a bulky medicine. They have a long tube. There are chances of getting infection is higher in nebulizer.
The
So
hypertonic saline might sediment in the circuit, isn't it? And
yes, exactly. And the humidity which are created, all these are a good environment for fungal deposits, fungal infection, and some bacterial infection. So we have to make sure when we use the nebulizer is to clean it regularly and to dry it and to clean all the tubes, to clean the mask and make sure it doesn't transmit infections if not
just a
looked at.
quick question before we close this. I mean, can you comment on use of saline in infants? Because many parents seem to use it for congestion, not for airway problems, but upper airway congestion. And they do feel symptomatically there is a relief. I mean, saline nebulization in the young infants.
Sure. Yeah, saline nebulization, there are two kinds of salines nebulization, the normal tonic saline, which is 0.9%, and the hypertonic saline, which is 2.3 or 3%, which is available in the market. The normal saline, it's mainly for the upper airway. If there is a little bit of congestion, it can just help to unblock the nose, similar to the nasal irrigation or nasal saline irrigation. It's not as effective, frankly. It's not as effective, but it will do some help. There is no evidence in the literature for this to work, but from our experience, we can see based on the feedback from the patients that if they use it for upper airway congestion, they feel a symptomatic relief. The hypertonic saline, it's more useful in cases of bronchiolitis and a little bit of lower airway viral wheeze and little airway infections, because there is some evidence and some studies which shows that these hypertonic saline help to decrease the viscosity and the mucus which is stuck in the lower airway.
Thank you. So I think to summarize, we can safely say that both devices are effective, but in terms of nebulizer, you have a lot of variation in the effectiveness of the machine depending on the cost, depending on how you use it, because half of it may go outside the mouth, and the particle deposition outside in a crying child. And some people even comment on effect on the eyes of a nebulized steroid if the particles are going into the eyes.
Sure.
So, I mean,
Sure.
inhalers have more reliable.
This is a very important point you raised there, Sridhar, because with the nebulization, you have to make sure it's a very good seal. And most of the time, parents are not sealing the nebulizer. They're just giving it around the mouth because the child is scared of the noise, is scared to put the nebulizer on. So that means more than 70% of the medicine is outside in the air or deposited on the eye or on the face, and it doesn't go down to the lungs. So while in the inhaler and the spacer, at least with a good seal, you are assured that most of the medicine goes down to the lung.
And it's much quicker to use the inhaler with the spacer, but remember that it should be, the spacer is very important even in the older children. I mean, because the dose delivery has been shown to be more effective. I know we didn't exactly have a 5-minute session, but this is a very important topic, so overshooting the time is good. If any comments or questions, I mean, please mention and I will forward to Dr. Basil for his response. Thank you so much. With this, we close this session.
Thank you, Sridhar. Thank you for the invitation, and hopefully we will talk more in more detail in the other sessions. Thank you.